Good morning and welcome to the new edition of Frontiers of Knowledge. The Zika virus has been troubling people all the time, and this virus is essentially causing brain injuries, brain damage to the adults, but more especially to the children. So imagine scientists making use of Zika virus to attack brain tumors. You need not be amazed. Poison kills poison has been an old adage. But to use Zika virus to kill stem cells of glioblastoma, the most dangerous brain tumor and most deadly to treat with, is something really amazing. You know, what happens is Zika virus is so bad that the children and the fetus can suffer badly. Infants born with the Zika virus are born microfilly, and the same deadly power of the Zika virus has now been used or can be used to treat the worst malignant brain cancer cells. And those brain cells are not treatable at all. As a matter of fact, if we look at the history of this dread disease of glioblastoma, which is the worst, deadliest brain tumor, every year 12,000 people in USA and more than 200,000 people all over the globe suffer from this brain cancer. The latest and the most prominent of them is John McCain, senator, who was diagnosed with this cancer this year. And the aggressive nature of this brain cancer includes surgery followed by radiation and chemotherapy. And then it's not cured. It comes back within 6 months. These cells, damaged, can revive themselves, divide, subdivide, and produce new tumor cells. And would you believe that 95% of the patients die within 5 years of the diagnosis, even after this treatment? And the remaining die and 50% at least have died within 15 months. So deadly is the disease. And now the research shows that the stem cells behave much like neuron progenitor cells who are able to self-generate. They create new cells even when they are being destroyed. And that's why when the doctors have been thinking that the cancer has been cured, in fact, it has taken a new shape. It reminds me the death and the birth of the demons in the old legendary tales. And the term is extremely harmful as far as the doctors are concerned and to the patient. But the research shows that 2 different strains of Zika virus can kill the infected absolutely. And the remission is complete and there is no recurrence. The researchers have used it, injected into the brain tumors of the mice, and they've seen that normally while in the earlier test, the mice infected with the Zika virus survived 3 to 4 months. Here they have been able to survive 2 years. And the research is still going on. But according to the Cancer Institute of USA, if mice have been without remission, without recurrence for 2 years, there is every likelihood that they have been cured. And now FDA is accepting the results of the research, and they have said that Zika virus infection can be used the way smallpox infection is used as a vaccine. And it can also be used along with the radiation and chemotherapy as a complementary step to cure the brain cancer. While Zika virus and target stem cells, it would lead the rest of the tumors to be treated by radiation and chemotherapy. So treatment is used along with the current therapies. And the professor at the School of Medicine and Neurology say that it seems scary to inject people with the Zika virus. But we have seen, observed, and the observation has not been confined to a month or two, but to a period over 3 years. That the virus injected directly into the brain, possibly during the surgery to remove the primary tumor, would avoid triggering an immune response. So those stem cells which developed an immune response and they were immune to being destroyed would be destroyed now. In adults, it is a boon. For children, it's a blessing. And now, there is another step further they have taken to make the virus safe. They have tested it in other brain tissues and introduced mutations so as to judge whether virus has the ability to fight immune responses, and they have been successful. The virus was able to grow itself into the unhealthy tumor cells and then kill those tumor cells. So this is quite a breakthrough in the brain cancer treatment. And according to Washington School of Medicine, this study would be a real breakthrough in medical knowledge. And then talking of the cancer, there's another development. Scientists have developed a pen-like device. It's a pen, looks like a pen, but it's not a pen. And it can identify cancerous tissues during surgery and deliver 96% accurate results in just 10 seconds. This is called mass spec pen. It is 150 times more fast than the existing technologies. It's innovative, disposable, handheld, and gives the surgeons precise diagnostic information about what tissue to cut and what to preserve. It is helpful for improving treatment and reducing chances of the cancer replacement. And the relapse would not be there. Now what happens is, with the Zika virus, you inject the Zika virus, hold the pen, and you can identify during the surgery itself whether any other cell is there which is cancerous or is likely to be cancerous, because this pen also identifies and forecasts the possibility of the cancer in those cells. So, and in case you find that there is a predisposition of some cell to have cancerous growth, that cell can also be subjected to Zika virus injection and removed. So the relapse would not be there, the recurrence would not be there, and as they say, prevention is always better than cure. Now, if you talk to the cancer patients after surgery, one of the first things the patient asks the doctor is, have you got the cancer all out or would it return? And mostly doctors cannot say anything because they know that the cancer is never exactly wiped. Doctors are aware that it would return. But now with the Zika virus, it would not return, and they would be comforted that the mass spec pen has identified that there is no cancer in that cell. And when there is no cancer in that cell, the relapse is not going to take place. This study, as reported in Science Translational Medicine, has been done already on the human beings. 253 human cancer patients have had cancerous stem cells in their breast, lungs, thyroid, ovaries, and they have been treated there. All 253 have survived and there has been no relapse. Now what has happened is, another thing, that using this pen, the researchers have extracted and analyzed the metaboles. These metaboles are small molecules in the tissues. And in fact, they are the natural, what they call the fingerprint of the tissue, which is then instantly evaluated by the pen. And the pen then displays in digital shape whether it's normal or cancer. So the moment the doctor sees on the screen the word cancer, he can inject Zika, and then it's not difficult. The amazing thing is that you have to hold a pen against the patient tissues, like the pen we had talked earlier, which takes one drop of blood and identifies different cancers. So this triggers an automatic analysis using a foot pedal, and the result is there in a few seconds. These two advances in the medical science are in fact a boon to the cancer patient and a great tool for the surgeons. They hold high promise of treatment to the patients, and the dreaded cancer disease is likely to, not to be eradicated, I won't say that, but can be mitigated to a great extent. Now the point arises, the doctors are still worried about one thing, and that is Zika virus has been contained, has twice the epidemic started and twice it was contained. So how to get the virus? So they are setting up Zika farms where the special mosquitoes carrying Zika virus will be bred. But the breeding has a danger by itself. Suppose those mosquitoes in the contained places escape, then they can cause an epidemic outside and innocent people can suffer. So the liability of the researchers is huge one, but certain insurance companies have come forward and they have agreed to underwrite. Definitely precautions would be taken, and there is a danger every time you do something. However, in case necessary precautions are taken, there's a possibility of reducing the danger. Until today, no progress has been made without having some attendant danger. The matter to be evaluated is benefit more than the danger? Can the danger not be mitigated? And in case danger can be mitigated, let's use it. A patient suffering from cancer, and the most deadly form of cancer, would look towards these two developments with hope, and their sagging spirits would rise. Let's see how the research is used for the benefit. Till today, research has been done on 253 patients. When it's actually used in practice, then we would know the real results. But the promise of the recovery of the patients of the deadliest brain tumor are there. Let's hope the promises hold good. Thank you.